To present the first SARC Symposium talk, this is going to be a Myanmar session by esteemed Dr. Than I. Sir, I invite you at the podium, please. And Dr. Prateek Das will be chairing the session for us. Timer reset to 15 minutes, please.
Namaste. And then a very good afternoon to all my chairmen and then the ladies and gentlemen. I'd like to thank the organizing committee for inviting me to this beautiful city of Kolkata and then giving me an opportunity to give a talk on the evolution, the difficulties and challenges of kidney transplantation that we are facing in Myanmar. I'd like to start with the introduction that chronic kidney disease leading to chronic failure, kidney failure, is a major public health problem and a challenge worldwide. It is also an important contributor to morbidity and mortality from non-communicable diseases, even though in our developing world we are concentrating more on communicable diseases, but still there are so many non-communicable diseases that we have to face. It is then increasing the incidence very recently because of the aging population and rising prevalence of diabetes and hypertension. It is estimated that global prevalence of chronic kidney disease will be about 9.1% of the whole world population. And then but the number of people receiving renal replacement therapy because of end-stage renal disease, it exceeds 2.5 million in the whole world. But regretfully, globally, only 1.2 million people, they died from chronic kidney disease due to lack of access to proper renal replacement therapy. And then less than 10% of patients with organ failure have access to solid organ transplant worldwide. Then what is the situation in Myanmar? Myanmar is one of the members of the 10 ASEAN countries and is a home to over 55.5 million people, including 14 states and divisions. According to the estimate of Global Burden of Disease Study in 2017, the number of chronic kidney disease in Myanmar in various stages could be more than 5 million out of the 55 million people. But only, it is a sad thing that only less than 15% of the end-stage kidney disease has access to renal replacement therapy in Myanmar. Hemodialysis is the main form of renal replacement therapy, 90%. Even though continuous ambulatory peritoneal dialysis can be more economical, but because of the lack of educational level among the average population, only 10% of the people they have been placed on ambulatory peritoneal dialysis. We have altogether only 116 hemodialysis centers in the whole country, and we estimate that nearly there can be 4,000 patients who are on the hemodialysis. Even though we understand that transplantation of the kidneys, when it was properly done and applied, is a treatment of choice for patients with end-stage kidney disease because it is of lower cost in the long run and it's got a better outcome. But unfortunately, less than 5% of patients in Myanmar with chronic kidney disease can have a renal replacement therapy offering kidney transplantation. When you look at the global incidence of kidney transplantation rate, then we can only do 1.2 per million population, because so far I could only do a little over 750 kidney transplants starting from 1997 to up to now. And then also we have very few kidney transplantation centers, only 2 per million population out there. We have only 10 transplant centers, 8 in the government sector and 2 in the private sector. In Myanmar, we can only start living donor kidney transplants. We still could not do the disease donor kidney transplantation. Has not started yet because of lack of legal framework governing brain death. And by so many, we have to convince the people who has got their religious, cultural, and social constraints. But we always have a dream to do kidney transplantation. Before 1995, a lot of the even wealthy people, they have to go abroad for kidney transplantation. And then I must owe my greatest gratitude to my friend, Professor Gordon Williams from Hammersmith, who I met when I was in England. And then he was very kind to come and do the 5 successful kidney transplant in March 1995. Then with his inspiration, then we first did the first successful kidney transplant by only the Myanmar doctors on the 8th of May, 1997 at Yangon General Hospital. These are the number of kidney transplants that we have so far. Apart from 1995 to 2023, there are almost altogether 10 centers only, and out of that 8 are in the government sector, and only 2 are in the private sectors. You can see that we are doing more cases, even though more may be in the private sector than on the government sector, because the government could not provide sufficient fund to the needy, poor people. This is the number of kidney transplants there. We are doing more kidney transplants in the military hospitals because it is rather easy at the moment. We have an unfortunate political situation, and then still trying to help them to do transplant. And then they have the 435 were done on their military hospitals, and only in the civil hospital we can only do 157, and then the private hospital we are now doing 118 patients in the private hospitals. This is the yearly number of kidney transplant in Myanmar, starting from the data that I could collect it from 2016, 2023. The highest number of cases that we could do per year is only 52. And then because of the COVID, 2021, we could not do any transplant. Now we are picking up steam, and then now we are doing in 2023, we already have done nearly 30. This is the 22, now is 30 cases now. The age groups, we are doing more younger donors have been donating their kidneys, and then you can see that between 18 to 30 is the highest, and then the lowest is the 15 to 65. Also the recipients there, the highest age group of the recipients are between 31 and 40 years of age, and then slowly we're not doing a lot of people because the government, as they wish to be cost effective, they have advised us not to do even patients over the age of 60, but we are now doing patients with the age of 71. It is now the oldest that we have been trying to do slowly. With the gender, there is still gender discrepancy, and you can see that the females, they give more than they are receiving, and that is not because of, it is mainly purely, it is a cultural factor, because in the Myanmar society, always husbands, men are been regarded as regarded and valued, and they are respected as the head of the household, the breadwinner, and they're probably ladies, they don't need more. It is not, we do not discriminate at all. There is no sex discrimination at all in Myanmar. And the surgical technique is mainly by open surgery. Nearly 90% we are doing by open surgery, and only about 10% we are recently doing by laparoscopic and hand-assisted donor nephrectomies. Then because of our rigid selection of cases there, the results are quite comparable to that of the global standards. 1 year graft survival will be about 98, and then 10-year graft survival is about 88. We have a very low rate of rejection, less than 5%, and the longest graft survival today surviving is 28 years. It's still surviving. Then what are the difficulties in China? Why that we have been knowing that kidney transplantation is the preferred method of treatment for patients with chronic kidney disease. Why are we then slow in doing kidney transplantation? We have the difficulties and we have the challenges. The first and the most major hurdle that we have been overcoming is the economic constraints there. As we all know, dialysis and transplantation are expensive therapies even for the developed countries, and it will be prohibitive as well as it will be difficult for us, particularly for people staying in the emerging economy or the developing countries. The cost per HD section in Myanmar is about 25 United States dollar, and then because many of the dialyzers, we have to reuse it again, and only 70% of the patient, they are mostly on twice weekly dialysis. Only about 10 to 15% they are able to do a thrice weekly dialysis. And then even transplantation is even more expensive. It is about, the initial cost will be about 5,000. In the government hospital, we did it free, but even then, the patient has to spend nearly 5,000 US dollars from the out of the pocket there. Why are it's so difficult, even though if it's about 5,000 compared to the West is quite a small number, because of the low level of government health expenditure. When the government is using, we are still a poor nation, and the government is using only 3.5% of the GDP on the health, and nearly 75% of the patient, 75% is out of the pocket payment by the patients there. So it is very expensive for majority of the patients there. And then also there is limited funding to transplant program, because in terms of priority, kidney transplantation is not in the high priority list by the government. And also the government has got a strict control of kidney transplant in private hospital. They will evaluate again and again whether they should give a license to do transplantation in the outside private clinic. There are only 2 now at the moment. So health insurance also non-existent, and there is no local tissue typing laboratory so far. Cross-matching, tissue typing, everything is going to be done overseas. Therefore, it delayed the transplant procedure, increasing the cost. Also, drug level monitoring, and then to get the affordable generic immunosuppressants also are not been satisfactory. Then preemptive transplantation, we know that it is better before the patient is on dialysis because of his reduction in transplant failure, reduction in mortality. It has been slow to adapt, and it is underutilized in Myanmar. The second factor is expanding education, also not only to the general public, but also to the primary care physician, government officials, and policy makers there. We have to increase the awareness that kidney transplantation is the essential and preferable cost-effective treatment. But most patients, they are not been well informed. In one study, it is a regret that only 43% of the primary care physicians, they take time to educate the patients about transplantation within the first 3 months of dialysis treatment. Many patients have to do it, they have been on dialysis for months and years there. Because some centers, they may have even a financial interest to keep patients longer on dialysis. The third factor is the lack of trained workforce. In Myanmar, we have only 70 urologists and 46 nephrologists registered as specialists. We need a lot of more training, and although local training is extensive and valuable, but we need scholarship for fellowship training and creation of long-term institutional links between developed and developing centers. Then you can see that we were blessed and helped by many of those societies, including TTS, the International Society of Nephrology, also Korean transplant team. This is a Korean transplant team coming to Burma and helping to develop the national transplant program. You can see the beautiful lady, Curie here, the center, and also the president of the TTS, Professor Marcelo, I believe. We were there and we have to work. So we trained extensively so that we could improve the number of kidneys. And the other one is a donor shortage. It's a universal problem, and waiting lists are becoming longer. It is particularly more so in country where there is no disease donor kidney transplantation program. Myanmar is one of the most generous nations, and religious and cultural factors are not prohibitive to that of the organ donation. But even then, because of the government's strict and stringent donor criteria, and they have a restricted policy on living donor transfer for not favoring donors from outside immediate blood-related family members. They only now allow the first degree relatives only. Spouse and paired kidneys are still difficult to. Therefore, lack of proper counseling. Also, there is no spouse and altruistic donation, and there's no plan for donation or anything. Then the last one that we're facing is a transplant tourism. It is thriving. It is because of our slow national transplant program, organ shortage, and absence of disease donor donation. So we have to be very vigilant for that thing, to try and prevent transplant tourism by increasing the thing. Therefore, in conclusion, increasing political support by the government, promoting collaboration or dialogue, transplantation between government and public mix, community mix is needed. Increasing education is also essential, and also minimizing the cost is also another factor, and to increase donor pool by relaxing government policies, that is, as well as taking care of the donors are important. Effective and strong legal frameworks are necessary to prevent commercialization. And then we have to increase the local capacity of kidney transplantation, which will reduce the risk. Thank you very much. Welcome to Myanmar.
So thank you, Dr. Than, for this nice presentation, and you shared your experiences. So as you mentioned that still you are taking the help of the outside surgical team, or you have started your own team in performing this transplantation kidney?
Sorry, could I?
Still outside team is coming and helping you out, or your own team, they are performing these surgeries nowadays?
Yes, we were doing it.
We are doing it. And share some experiences regarding other organ transplantation. Okay.
Right. Please. Okay.
Okay. So surgical issues, are you doing it at yourself, or still the people outside, they're helping you out?
No, now we are now doing transplantation with our own Myanmar team.
Okay.
Yeah.
But the immunological
But when they come, many people from Korea, particularly liver transplantation, we're studying, and then they come, and then we always welcome to all the people who will help us, because learning is always universal and lifelong.
Yes.
There is no end to this thing. So any people coming abroad and helping us, we are very happy and grateful. It makes me the feeling that I will never be left out from the international community. Thank you very much.
Yes. And is there any plan, because setting up an immunological lab now has become slightly easier because of the availability of the machines? They are not very costly also. So
I know. I
have you
understand
recommended
that.
your government to import
Yes,
those machines?
Yes, I've been pushing it there. We have 2 machines, Curie know it. But the thing is, we are most unfortunate that we have a change of government, and that many doctors are doing what Mahatma Gandhi called civil disobedient movement there. And many, they refuse to work. And then we are lack of manpower. We have machines there, and then there is nobody to handle that. That is the problem at the moment.
Okay, sir. Hats off to you, sir, with this immense political turmoil, and is a ruling ups and downs with army intervention. You are doing it, you are practicing this transplantation. We are extremely grateful to you and happy that you are practicing. That's why we have asked you to share your experience over there.
Yes,
Thank you,
because
sir.
I all remember to one of the Japanese ambassador when he donated instruments to my hospital there, and I thank the Japanese government for donating. He smiled and get up and said that, don't thank the Japanese government, thank Japan and the people of Japan. I will remember that. I will work not for the government. I will work for my land and the patient, the people. The conception is doing this. I all remember him talking to me.
Thank you, sir.
Thank you very much. Thank you.